Hello, once again. Welcome back. All right, so we have talked about from lecture 2 and 3, we've talked about the exercises, about breathing exercises. Okay, so we highlighted common breathing exercises that are supposed to be done, and in both lecture 2 and 3, following pathology that could affect the normal function, which was highlighted in lecture 1. Now, let us look at the common conditions, or just an overview of some of the problems that would affect the respiratory system. So amongst those, we shall focus on the communicable diseases. So let's look at the general causes of respiratory problems under communicable diseases. So we shall just have an overview of what we expect in this category. Okay, so under this category, we have the communicable diseases, which are those that are spread from one person to another, okay, through a variety of methods. They are spread from one person to another. They're the ones that are known as communicable diseases, meaning they can be transmitted. These are transmissible diseases. The variant of which is non-communicable diseases, those which cannot be transmitted. So this can be transmitted through a variety of methods, such as socio-economic status, the environment, behavioral factors, okay? And all those other factors, they can bring about this spread. So how this disease spread depends on the specific pathogen or infectious agent and the means of transmission. So it depends on the pathogen that you are talking about, because these pathogens are varied. They can be found in different types. Others are known as bacteria, such as those that cause tuberculosis. Okay. Others are viral infection, on which it is estimated that 44% of the diseases considered emerging in human beings are viral. Okay, amongst them are conditions such as coronavirus. Okay, HIV, SARS, and Ebola, very lethal conditions. They are categorized as viral infections. Others could be due to fungi, okay? Other types of fungi can infect the lungs or the nervous system. So fungal infection is very common everywhere and it is very lethal, okay? So according to CDC, parasites is an organism that lives that lives on or in a host and gets its food from or at the expense of the host. So parasites can also bring about some diseases that will affect humans, including the common ones, such as malaria. Others are known as prions. A prion is an infectious agent composed entirely of protein material called the PRP, short for prion. Okay, such as causing diseases such as bovine spongiform encephalopathy, mouth cow's disease. Okay, so these are just the pathogens that can transmit the conditions that will cause the effect on human beings amongst the non-communicable diseases. Okay, so the mode of transmission depends also on the infectious organism and may be transmitted either by direct or indirect contact. If it is direct contact, it occurs when an individual comes into contact with the reservoir. The reservoir at this point is where the pathogen is contained. Okay, direct with where the pathogen is contained, you get infected. That is referred to as direct. Or indirect occurs when the organism is able to withstand the harsh environment outside the host for long periods of time and still remains effective when specific opportunity arises. So indirect, it could be like you learn or you will learn in microbiology about life cycles of some bacteria, you will learn that some bacteria still remain infective even after disposing them, like those that move through the oral fecal route. Okay? Open defecation. Somebody can defecate openly on the soil. It even appears as though it has mixed with the soil. Those people that eat soil come, they eat the soil and they find the bacteria in there and swallow it. Okay? Commonly, those that go through direct contact are the ones that I refer to as the ones that are, the ones that go through person to person route, like through sexual intercourse, where the person who's infected directly gets it. The person who is uninfected directly gets it from the person who's infected, gotten direct from the reservoir. Also, through droplets, such as tuberculosis, to our interest in this presentation. Animal to person, such as bites, infected insects, or animal capable of transmitting diseases such as mosquitoes, and all those that will move through animal bites, such as yellow fever, Zika virus, and toxoplasmosis. At the end of the day, these will cause direct infection. Mother to unborn child through the placenta, and goes through the child through the vaginal canal during the birth process, such as hepatitis, HIV, herpes. So there are a number of conditions where they are contacted direct from the reservoir to the host. Okay. Under indirect, you find that the common one would be the contamination of the surface, such as food. Okay. You are passing, the contaminant leaves the contamination on the surface. You come, you also touch the surface. You even then touch food, you eat, then you infect yourself. That would have been transmission through indirect means or through water. We have cholera currently. We have cholera that is transmitted like that and it spreads like that. Through travel, okay? Through travel through the air, you find that there could be conditions such as tuberculosis as well as measles. Natural barriers are meant the body's defense system. The body also defends itself from these infections, the infections, the pathogens. The body tries to protect itself. And the first line of defense being the natural barriers, such as the skin, the membranes, the coverings of these body lumens, okay? Prevent the microorganisms from getting into your body. Unless the membranes, the skin are breached, then the pathogen can easily find itself inside, okay? Because just the mucous membrane itself, it contains uh, some antimicrobial properties that make sure that when there is a contact with a microorganism, these microbial properties are able to weaken the microbe and actually kill it. Local secretions contain immunoglobulins, principally immunoglobulin G and secretory immunoglobulin A, which prevent microorganisms from attaching to host cells. So the body has all these mechanisms to prevent itself. Okay, so the respiratory tract has the upper ways also. In the upper respiratory tracts also contains the mucociliary, the ciliary transport where cilia sweeps away the mucus and make sure that even when there is an organism, the mucus that is there with the antimicrobial properties and the cilia also works to clear that mucus so that there is the body saves itself from infection. Coughing also helps remove organisms, and if the organisms reach the alveoli, alveolar macrophages and tissue histiocytes also will try to engulf them. So there are all these mechanisms that are put in place by the body to save itself from infection and disease, but they can be outweighed by numbers. So microorganisms in large numbers can compromise these defense mechanisms. okay, including some pollutants, which we are going to learn in some other conditions that are still coming, that some pollutants can also render us susceptible to uh, developing these conditions, such as those pollutants that arise from cigarette smoking. They have the capacity to cause, to interfere with the function of the cilia. Okay, they have the capacity to interfere with the function of cilia, and at the end of the day, cause what presents like a COPD and have these type of infections, respiratory infections. The GI tract also protects itself through pH regulation. Okay, so the pH in the GI tract, within the secretions that are the pancreatic secretion, the pancreatic enzyme, it also tries by all means to save itself from infections. Peristalsis also removes microorganisms, and if delayed, can result in prolonged infection. Normal bowel flora can inhibit the pathogens as well. So all these, we know that there is normal flora, there are all these secretions in the lining, all those are meant to help to help the body in defending itself. There are others which are non-specific immune responses, such as the release of cytokines. Okay, the release of cytokines, which principally by macrophages and the lymphocytes, and the mount a response that involves that at the end of the day would kill or combat the microorganism. Okay, in their response, they cause fever and increased production of neutrophils by the bone marrow so that this can go to the infected organisms and combat infection. So this is, we are looking at the way the body defends itself from these communicable diseases. It also does that through inflammatory responses. Phagocytes, we know they are drawn from the microbes, and through chemotaxis, they bring the microbe near and engulf it, thereby saving the body. Therefore, there are also some specific immune responses that the other ones are non-specific. Then there are those that are specific, which include the antibody antigen responses. Okay, so following the host can produce a variety of antibodies that bind to specific microbial and antigenic targets. So through what is known as the complement system. So the antibodies will opsonize this microbe and thereby mount the immune system. This is what we are going to learn in immunology. You will learn about these mechanisms in immunology, but suffice to put it that the body will form antibodies which are specific to the antigen and destroy the antigen uh, completely so that the body saves itself from that condition. The notable communicable diseases we have in Zambia usually, or world over, it is the pneumonia, HIV, tuberculosis, and malaria. So these are very common communicable diseases that we have. Risk factors are in that, according to Boundless 2016, the spread and the severity of the infectious disease is influenced by many predisposing factors. Some of these are more general and apply to many infectious agents, while others are disease specific. Therefore, some predisposing factors for contracting infectious diseases can be anatomical, genetic, general, and disease specific. Amongst them, it could be due to climate and weather. Others could be due to environmental factors that are affected by them and can also predispose people to infectious agents. So these are the things that predispose you to getting some of these diseases. Other factors such as overall health, age, and diet are also important and are also important considerations in the prevention or spreading of these infectious diseases. So it is only when you know the risk factors when you can think of the prevention. There are also others that known as modifiable risk factors. They are known as modifiable because they can be changed. They refer to characteristics that individuals or societies can change to reduce the risk of infectious disease and improve health outcomes. Okay, such as cholera. Cholera is through modifiable factors, meaning it comes through factors that can be changed to suit your needs. This includes hygiene, including water and sanitation. Okay, what we are talking about in Korea. Vaccinations, those that can be dealt with vaccination. Malnutrition. Malnutrition is modifiable because once you improve the diet component, malnutrition goes. So yeah, it is modifiable. Food preparation methods and overcrowding amongst them. So overcrowding, like what we were going through in the coronavirus era, where social distance was preached, okay, preached, and we were taught to practice it, which we did, and we learned the the importance of social distancing. So overcrowding, once there is an infection in an overcrowded area, transmission can go at a very fast rate and can actually cover a very large population, which is very undesirable. Okay, types of diseases could be airborne diseases, which include uh, acute respiratory infections as well as TB, or it could be through the fecal oral route diarrheal diseases, which include the cholera. Okay, malnutrition. Okay, lowers the immunity. Malnutrition causes lowering of the immunity, and we know even from a normal person, when your immunity is lowered to levels which are kind of alarming, it gives rise to opportunistic infections. Find it easy to invade your body, get into immune system and cause disease. Therefore, you need to protect yourself against such. And amongst things that can develop are TB. TB, from the dormant TB that we have with lowered immunity, it can also resurface. Okay, so from malnutrition, you can even have this TB. Okay, along with overcrowding, poor nutrition may contribute to strong link observed between tuberculosis and poverty. So you find that in situations of poverty, usually overcrowding is there. Okay, it is there starting from where the spaces in which you interact from, even including where you sleep. You find that in one room you have people in number more than they are supposed to be accommodated in that room. So overcrowding, poverty, and transmission of these communicable diseases, there is a strong link to that. Depending on the etiology, the signs and symptoms occur. If it can either be viral or bacterial, therefore the systems involved also will present as such. If it is the respiratory, cardiovascular, or respiratory, or the central nervous system, the symptoms will present as such. And the stage of disease, is it chronic? Is it acute? As well as the clinical manifestations. Therefore, communicable diseases will vary widely and may be local to the site of infections, such as we see in conditions such as abscess, cellulitis, okay? Or it may also develop in multiple organ systems, and severe generalized infections may have life-threatening manifestations such as sepsis, as well as shock. So these are some of the signs and symptoms that will come with these conditions, but it they are specific to the causative organism and to the organ that is affected. The commonest ones, if it is affecting the cardiovascular system, will be hypertension, bradycardia, okay? And all those. The respiratory system, we are going to have effects on the breathing, which will affect the dyspnea, cough, hoarseness, nasal drainage, maybe congested, sputum production. So when you look at all these at the end of the day, they affect the cardiopulmonary system, which is our interest. At the end of the day, the person is going to develop decreased activity or reduced exercise tolerance. At the end of the day, it comes back to you as a physiotherapist. As a healthcare workers, it is very important that we recognize the symptoms of the most important infectious diseases and direct those affected to appropriate treatment as quickly as possible. Therefore, it is important to be aware of the role physiotherapy has in treating and advising patients presenting with these diseases. Okay, so a physiotherapist need to be exposed to this knowledge of the causative agents and the communicable diseases that can arise due to a number of conditions, I mean, due to a number of exposures, type of exposures, such as the ones that we have discussed in communicable disease. Physiotherapy needs to be exposed to that knowledge so that you are able to recognize the signs and symptoms and what could be transpiring. Okay, if it is a concern to do with a COPD or conditions such as pneumonia, you should be able to know so that you can draft properly the intervention regime. Okay, so in avoiding all this, hand washing has been found to be of very key intervention. As a very key intervention, hand washing, hand hygiene. As a physiotherapist, we need to learn how to use alcohol hand wraps effectively and utilize this frequently. The WHO identified these 5 moments of hand hygiene. Okay, so you wash your hands before touching the patient, before cleaning or aseptic procedure, or after the body fluid exposure, after touching the patient, or after touching the patient's surroundings. So these are summarized in this picture here. So you find that if you touch the patient in number one here, before touching the patient, you wash your hands. You are washing your hands before touching the patient so that you save the patient from disease. You may be coming from wherever you are coming from already with contaminated hands. So when you touch the patient, you are actually worsening the patient's condition by transmitting the infection that you have come with from wherever you have been before getting to this patient. So wash your hands before touching the patient so that you save the patient from that type of transmission. Before clean aseptic procedure, you are doing that so that you protect the patient. Okay, wash before so that you protect the patient. Number two. Number three, after body fluid exposure, after you expose yourself to the fluids of the patient, this one you are washing your hands again so that you protect yourself from transmission if there is anything that you could have gotten from the patient. Number four, here, okay, after touching the patient so that you save yourself as well. Then after touching the surrounding of the patient so that you are not getting anything from the patient. So this WHO regime has 5 moments of hand hygiene, 2 of which are for the benefit of the patient and 3 are for the benefit of the therapist. All right. Thank you so much for your attention. We'll meet in the next lecture.